Turning the volume on. Gotta get this going. It's been a little while since I've done it. So if you guys are having trouble hearing me or seeing me, let me know. I'm gonna get started in a few minutes. Pascal, I haven't even gotten started yet, and I already see. Okay, good. Hi, long time no see. I know it's been a little while since I've been on Periscope. I am Dr. Tolentino. I'm from Elite Health here in Miami Beach, broadcasting live from my office here. Hope everybody had a great Wednesday. This Periscope is basic brief introduction to omegas, omega-3, omega-6, omega-9, what's the difference between them, how does fish oil play a part in all of this, how much should we be taking, and so forth. We'll continue on further because I have a few more tidbits and some things that you guys need to know and learn about fish oil and the omegas. So the Periscope next Wednesday will also discuss this further. But I'm going to break it down to the bare basics so that everybody understands how important the omegas are. Omega-3, omega-6, and omega-9, they're fatty acids. So fatty acids are the building blocks to fat in our bodies and also in the food that we eat. And when you are digesting things, the body breaks down fat into the fatty acids, and that way it's able to be absorbed into your bloodstream. So there's different types. There's many, I'd say at least probably 50 or 60 types of fatty acids out there. But the important ones that we like to focus on when we're thinking of what's important with fish oil and the omegas are probably omega-3, 6, and 9. You can get omegas-3 and 6 only from outside sources. Your body's not able to produce it themselves, just like the omega-9. Omega-9 is a type of fatty acid that your body is able to produce its own, and also you can get that from the foods that you're eating. But the omega-3s and 6s you're not able to get on your own from your own body. You actually need to absorb and process it from foods that you're eating. So omega-3 fatty acids. Omega-3s and the 6s, they're in a group. They're called polyunsaturated fatty acids. And again, like I said, your body can't make them. There's certain types of things that contain the types of omega-3s, like alpha-linoleic acid. And the different types are really based on the carbon chains and where they are. So where they are as far as organic chemistry and the double bonds that are in these actual fatty acids that your body is absorbing. The most common sources that we can think of are probably the fish, when you think of fish oil, as far as the omega-3s go. And for the alpha-linoleic acid, which converts into the omega-3s, you can get that from different types of beans, different types of oils, also nuts, also flaxseed is very common. And that actually does convert into the EPA and DHA. And the EPA and DHA are the types. That's actually a type of omega-3 fatty acid that we're looking for. So when you guys are prescribed fish oil from your doctor, or even if you wanted to take fish oil as a natural supplement, it's important to pay attention to the quantity or amount of the EPA and DHA. Those on the back are the omega-3s. Those are the omega-3s that your body needs. A lot of new prenatal supplements as the brain is developing, if you'll notice, like women that are looking for prenatal vitamins, they have DHA in it. It helps with great brain function and growth. As an adult, a lot of us don't really have the right ratios of the omega-3s and the 6s and the 9s, and that's what causes us to have a lot of inflammation and a lot of chronic disease problems when you get older, like heart disease and strokes and so forth, and even some types of cancers. It's important to have this balance, the balance ratio, just like it is important with your hormones to help keep them balanced, or else that's what it does. It causes havoc on the body, like the cardiovascular disease and the strokes, heart attacks, and those types of things. So the purpose of discussing this is for you to understand that when it comes to the omegas, most of us, or most of the American population in the Western diet, we unfortunately have a very bad balance of the omega-3s and the 6s, particularly the 3s to the 6s. Our body is absorbing too much omega-6s from the diet, and unfortunately it becomes super off balance. So everyone is getting too much omega-6s into their bodies and less omega-3s. And because of this imbalance, this is what causes the problems. So on average, most people should be taking in at least 1,000 milligrams of the DHA EPA that you will see on the back label of your supplements. So if any of you have fish oil bottles at home, pay attention to how much you're taking. If you're trying to help balance out the omega-3s and 6s so that you have less inflammation, then you want to be taking at least 1,000 milligrams of the EPA/DHA, which are the omega-3s. A lot of supplements out there may not be giving you enough, or they may have other recommended daily amounts, but what's important is that you're at least getting 1,000. Most people like to take more than 1,000, and I agree with that, because depending on the medical conditions that you have and whether or not you believe your body actually has a lot of inflammation, and if you want to be sharper with your memory and with brain function, then yeah, you should be taking at least more than that. I would probably take at least 2,000 milligrams of the EPA-DHA. So if you're trying to make sure that you're balancing things out, I think that's very, very important. Yes, 1,000 milligrams a day of the EPA-DHA, which are your omega-3s. So this will help at least help balance out. When they have done studies with like the National Institute of Health and a lot of the research journals and stuff like that out there, they mention how important it is, because right now most Americans have very high off-balance ratios of the two. So at least 1,000 milligrams will be important for you to take on a daily basis. And for those of you who want to look into the subject further, there's further reasons to take more than that. Also, they've noted recently in depression, a lot of patients that are on anxiety medications or antidepressants, they're actually taking higher dosages. So instead of taking 1,000, they're taking more like 2,000. Also, some patients that have really high cholesterol levels, they're even taking higher amounts to help reduce your triglyceride levels. There's even prescription medications out there with higher dosages of the omega-3s to help combat that. If you're trying to take it on your own, some doctors do prescribe some omega-3s. It's important to also know that those quantities of the EPA-DHA sometimes can actually be detrimental to you instead of beneficial. If you ever have had a concept or an issue where you've taken omega-3s and you've taken fish oil and it's had the opposite effect on your cholesterol, then that's a problem. There are some genetic markers that unfortunately keep people from absorbing fish oil very well. One that's noted was the ApoE gene, and that in particular, unfortunately, those patients that have this genetic marker, they don't absorb fish oil very well. So if a doctor tries to recommend it, they actually has the opposite effect. Instead of making their cholesterol levels reduce, taking higher doses of that combination actually raises their cholesterol levels and their LDL and their triglyceride levels. So if you think that that's probably, a concern for you because you've tried taking fish oil and it's actually counterbalanced or had an opposite effect on your cholesterol, make sure you talk to a doctor who is educated about that and understands that. Those types of patients usually can still take fish oils in less quantities, but they can take the EPA-only fish oil. And certain companies out there offer EPA-only fish oil for patients that have that issue. So we will talk about this more again next Wednesday. I have a few more tidbits and things that you should be using it for. But when it comes to the omegas, majority of us need more omega-3s. It will help keep your brain sharp, at least 1,000 milligrams. It will help with your heart so that you have less heart disease. It will also help with your skin. I actually do give it to my dog, Jasmine, because it does keep her a lot healthier and sharper, and her skin coat's really nice now with the omegas. It will help to reduce the inflammation so that you have less of that off balance between the omega-3s and 6s. And overall, it's great for your health. You'll probably see a lot of articles in magazines and so forth that also discuss the benefits of fish oil. But for a majority of us, it's very, very good for us to keep taking it. So at least 1,000 to 2,000 on a daily basis of the omega-3 EPA-DHA, and turn the bottle on the back so that you can double check to make sure that you're getting the right amount. So I hope that you guys all found this very informative, and we'll talk next Wednesday at 5 o'clock about a few more tidbits regarding the omegas. And I will see you then. If you have any questions, feel free to email me. It's jt@elitehealth.com, and I'll see you next Wednesday.